So, welcome to my dear students. So, today we are going to discuss about gallbladder stones. It's a very common disorder in the abdomen. Before starting, we should know anatomy of the brief anatomy of liver, gallbladder, and the pancreas. So, this is the liver, and those are the intrahepatic these are the intrahepatic ducts. So this is your right hepatic duct, left hepatic duct, then it is coming to this is called the common bile duct, and then is cystic duct. Then this is the pancreas. This is the pancreas, and this is the pancreatic duct, and those are joined together and connecting with duodenum, and that opening that is called uh, ampulla of Vetter. You know all these things. This detailed uh, anatomy I have explained in already explained in the earlier lecture, and here those are the some muscles are there as to control the uh, uh, opening of uh, pancreatic duct and bile duct and this there are some muscles are there. So through that, those are the muscles which are connected to bile duct. It's that is called sphincter of the common bile duct. And similarly for the pancreatic duct, there will be sphincter of pancreatic duct. And in in the uh, opening where this ampulla vater is there, there also one sphincter is there. Sphincter basically is a kind of muscle which can contract and relax. This will control the opening of particular duct. So this is the very simple anatomy of liver, gallbladder, and pancreas. So this liver will produce bile. So that bile will store basically inside the gallbladder. So what exactly bile do? This helps to fat digestion. Okay, so finally the absorbable form of fat which we are consuming through food, that is fatty acid and glycerol. So this bile, it will this emulsify the fat, the food fat. Means fat is oil. Say you want to try to you are trying to mix water and oil. So you take one cup of water, 1 cup of oil, and if you pour it in a glass, it will not mix, na. Then if you in a mixie grinder, if you very nicely you grind mix it, blend it, then some foam kind of things it will form. So uh, basically that is called the emulsification. Okay, so basically this bile will increase the fat surface area so that the digestive enzymes can work efficiently, and also this bile absorb the fat soluble vitamins which are ADEK, and eliminates the cholesterol from our body, and other waste. Okay, and also neutralize the stomach. There is a gastric glands, the peptic acid and HCl, all these things uh, it will produce from there, and that will be neutralized. This bile are slightly alkaline, and it will neutralizes the stomach acids. Okay, so how this bile will uh, uh, the liver will produce the bile. Okay, and it is transported by this uh, intra uh, intra hepatic bile duct, and it will be stored in the gallbladder. Okay, so the bile is produced by the hepatocytes, those are the liver cells, and transported to the gallbladder for storage via this intrahepatic duct. Those are connected finally to left hepatic duct and right hepatic duct. Those are uh, again uh, connected with joined with common hepatic duct. Then from there it is through the cystic duct and the gallbladder. And when the bile will be released, then from cystic duct, common bile duct, and it will be released at duodenum area. This is the transportation uh, of bile. Okay, forming, then storage in the gallbladder, and again from gallbladder to intestine. What are the basically the composition of the bile? So the color will be yellowish green, and as I told you, it is slightly alkaline in nature. Okay, so the 95 to 97% is water, uh, and there will be some bile salt, that is 0.7%. Okay, this is a glycocolate, and this is uh, taurocolate. Those are the bile salts. This basically it will help to emulsify the fat in the food, and also it will increase the surface area for the enzymes to act on the fat during the digestions. And there is some pigments also there. This is bilirubin and biliverdin. Those are basically formed during the breakdown, or when the RBC or the hemoglobin death. That time the liver will basically, liver is a filter for the blood. Okay, so those waste product means that is due to the breakdown of the red blood cell, this bilirubin and biliverdin, those also the liver this bile duct sorry, the bile will contain 0.2% of such protein. Okay, some phospholipids will be there, and one important thing is the cholesterol. So the body cholesterol, if you excess, so normally that will be in bile also, the cholesterol level will increase, and also the some electrolytes like sodium, potassium, and it's the bicarbonate. Okay, these are the composition of bile. Then how this gallbladder stone forms? Okay, so when the substances in the bile are primarily cholesterol or bilirubin, if those are getting highly concentrated, and it naturally it will start to crystallize. and often due to an imbalance in bile composition, or sometime when the gallbladder is not getting empty properly. So this, due to such reason, if it is accumulates, all the reasons accumulates together, and this will uh, 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 due to that, the bile composition concentration will get increase, and slightly it will slowly it will start to crystallize. Okay, and there is some solid sediment will form, and over the time this will grow. So the process to form the gallbladder stone is first the supersaturation, when the bile becomes overloaded with cholesterol, and exceeding its the amount of bile salt. This concentration increasing eventually leads to crystallization. Then also, if the gallbladder is not getting empty completely, or properly is not getting empty, then naturally again the concentration will increase, and the bile salt and cholesterol, those will get stagnated, and promoting the crystallization. Okay, then nucleation, it is the growth of the crystal. Slowly it will grow. So these are not life threatening uh, medical condition, but still you should know about this, and its prevention and diagnosis. It is better to understand the thing and to address it timely. Now, coming to the types of gallbladder stones, so those are two types. One is cholesterol stones, another is pigment stones, and sometimes those some the cholesterol stones, those are yellowish in color. Hmm. When your bile, when the cholesterol is increased, so eventually this will crystallize and form this color of stones. This is the common case. And the pigment stones are slightly dark color. Okay, and this is due to excess content of bilirubin. And that can happen due to liver disease and few uh, blood disorders. And sometimes some stones you might have seen, those are the mixture of these two, this cholesterol as well as the pigment. So this is dark yellow, some dark color will be there, and yellowish also there. Combination of these two also, um, sometime it found, but it is rare. But mostly it is a cholesterol stones, then it is pigment stones, and very rare that will be mixture of these two. Now, what are the reason for this gallbladder stones? What are the reasons? So the most prominent reason is your diet and lifestyle. Okay. People, nowadays we are eating a lot of refined carbohydrates, unhealthy fats, outside fast foods. Okay. Now so many supermarkets are there. They are processed food and all these things we are eating. So this will cause, uh, this will increase the body uh, LDL, and that will cause gallbladder stones. Some medical conditions like your diabetes mellitus, Okay, and other kind of blood disorder also can cause this gallstones. Some hormonal changes. If the estrogen is increased, that can increase cholesterol, hence, and also the it will slow down the gallbladder emptying. So normally, during pregnancy, this estrogen level will increase. Okay. So uh, normally, not during pregnancy. This this is after pregnancy. Okay. So in during the birth control, normally we will when the ovulation you want to control. So that time this cholesterol may increase, and sometimes some hormone therapy. So those are also a cause. Obesity. Sometimes we are over dieting, and there will be rapid weight loss. This also will liver will uh, filter out the extra cholesterol. Mm. Okay. Normally, it has seen that the woman, the fertile woman of age around 40 and slightly fatty and fair, there is a our teacher used to tell there is a 4F formula, 4F. So those that is the most common: female, fertile, fair, 40. So a fertile female of age around 40 years who are fatty and fair, those having the highest, it has been seen that those are likely to very likely to develop gallstones. Okay, and already we discussed some uh, uh, health condition, metabolic disorder. Okay, uh, um, uh, some infection or inflammations, the some disease in the intestine also can mm, cause the gallstones, mainly in female, during the pregnancy and in the during the birth control. So um, uh, there will be a significant hormonal concentration change that also uh, eventually will trigger the gallstone formations. What is the common symptoms? There will be sudden abdominal pain. Okay, and this pain can propagate normally in the shoulder blades, in means the scapula area, that are mainly in the right shoulder. You will there will be some pain, and sometime you will experience some pain after heavy fatty meals. Once you take mutton or pork, like red meat with where the fat is more, sometime you will experience the abdominal pain, that also may be due to the uh, gallstone. Is the person can experience nausea and vomiting, sometime fever. Ah, maybe there's some inflammation. Due to that, there will be fever, and sometimes jaundice. The skin will be slightly yellowish, and eyes will be slightly white, and your urine color will change. There will dark color urine, and stool will be light colored. Sometime there will be rapid heart rate and abdominal tenderness. Those are the common symptoms of gallstone. And how to identify? So this is very simple. This I have this image is taken few years back. One of my auntie. I only took this, and you see that multiple multiple stones are there. So other things I hide it, the details. These are the device I use. It is Bluetooth connected ultrasound transducer. In your one app is there. So this is available in. I purchased from Alibaba. It will be ranges from 20,000 to 50,000. So very simple to use. App will be you can download the once you purchase the transducer with that the QR code will be there. If you scan the QR code, then you can install the app in your Android device, and then simply using any gel, you use this probe in the abdomen, and you will get the uh, uh, picture of that. Okay, very easily, simple. Using ultrasound, you can find it. Ultrasonography, you can find it. Then the coming to the complications. Normally, it is not life threatening, and if the gallstones are too small, or so this will normally uh, this will not create that much problem, but still sometimes some cases some problem may happen. So one thing is, say the if the uh, gallbladder stones are a particular size, we can obstruct the cystic duct. Then there will be because the bile will not able to empty, the gallbladder will not able to empty properly. So this will cause the inflammation of the gallbladder. This case. So this is called cholecystitis. So in cholecystitis, there will be inflammation in the gallbladder because some gallstone stuck in the cystic ducts. Another thing is this gallstone can transported from the cystic duct to this common bile duct, and there got stuck. Okay, this is called cholangitis. Is the inflammation in the bile duct. Another is sometime due to this long time, if it is stuck, so this will create some pus in the gallbladder due to the duct obstruction. This is called gallbladder empyema. This is also one kind of problem. And say in the in something is traveled, and uh, at this point at this point this got stuck. So what will happen? There will be a uh, there will be due to that reason there will be a inflammation in the pancreas. Those is that is called pancreatitis. So these are the slightly uh, problematic medical conditions where immediately you have to do something. But rather than this, normally there will be not that much problem. Okay, so it's not very serious things. So always better to, once this kind of problem is there, so better to remove the gallbladder, because the gallbladder is basically work here as a storage of the bile. So if you cut also, nothing problem will be there, because whenever needed, rather than storage, it will come to the intestine. So it will be not, and the operation also, it is not a very complicated or major operation. ये झंझट वाली कोई बात नहीं, simple है. Very simple. So primary the treatment for this is uh, it is called cholecystectomy. It's simple. It's a very simple surgical removal of the gallbladder, and normally nowadays it is done uh, via laparoscopic surgery. There will be some hole. Doctor will make some hole in the uh, abdomen, and through that they will cut the gallbladder and remove from the abdomen. It's very simple. So nothing to worry. Then to avoid gallstone, what is to be done? Okay. So definitely you have to limit your food. Mainly your food should not contain, means your food should contain as less as possible fat, cholesterol and refined sugars. So definitely you have to avoid the fried foods, fatty foods, and the red meat, red flesh like your mutton, beef, pork, all these things, and some dairy product which are full, that is full of fat. Hmm. The processed snacks, the fast food, the cream, cheese, those kind of dessert. These things can cause the increase the cholesterol in your body, and also the gallstone. Simple. You hydrate your body, drink plenty of water, take green vegetables and fruits, avoid red meats and the outside. Completely stop outside food. Even though your children's spouse they are forcing to go out, you have to completely avoid it. Simple. Take whatever some boiled food also sufficient. Healthy diet you maintain, nothing will be problem. Thank you so much. So I have given one very basic idea about the gallstone, how it is formed, what may be the complications, how it is to be handled, and what are the lifestyle you need to change to avoid such problems. Thank you so much. Thanks for your patience.